Welcome to the Feels Club and Anew Therapy podcast, where science, compassion, and real conversation meet. I'm your host, Mauricio Laguan, and each episode we sit down with a medical expert from Anew Therapy, Utah's trusted mental wellness clinic, where we talk about mental health, treatment options, and finding a path for healing for you. Today's topic is ketamine therapy. What is it? A step-by-step guide and walkthrough of what it's like at Anew Therapy. I'm joined today by Dr. Julie de Azevedo Hanks, a licensed clinical social worker, and honestly, a person who needs no introduction. Dr. Hanks, thank you so much for being here. I have an official bio and I'm getting nervous just literally talking about it. You do so much. You're an expert in coaching and helping women, particularly relationships, faith transitions. You do so much for our community here in Utah, and I'm just so excited to have you here on the podcast.
Thank you. I'm honored to be here and excited to talk about ketamine-assisted therapy.
How did you get into ketamine-assisted therapy? Like, what led you to this path to also add that to your already very impressive resume?
Oh, thank you. Thank you. So I've been a therapist in Utah for over 30 years. And over the last maybe 5 or so years, I kept hearing about, psychedelic assisted therapy, ketamine assisted therapy, and the research that's coming out, how effective it is. And I was like, what is this? And so I wanted to experience it. And I have struggled with depression and anxiety in my life. And so I decided to do a series myself. And it was so helpful. And I wasn't in crisis. I was functioning fairly well, but like just the underlying stuff, And it helped me go through a really difficult time with a lot more emotional balance. And I thought, you know what? This is really cool. Like I can see this is the next wave in therapy, is integrating ketamine, and then down the road, we're going to see other psychedelic medication being approved. And I just thought this is what's this is where it's at. And a lot of therapists are afraid of it, but I tend to embrace the new. Let's do this.
Yeah.
And so I started a certification program. I'm in the middle of that right now.
That's
and
so cool.
It's been amazing. And then I partnered with Anew and have been working there for several months and have just absolutely loved it. And after doing talk therapy for 3 decades, it's kind of fun to try something that's really different.
Yeah.
And it's helped so many of my clients. And I've referred clients that I've seen, for a long time to like, hey, I think this might be helpful. And I will have them come to Anew and we'll do the ketamine there and then do the integration.
That is really cool. To be in a field for over 30 years and still feel like there's emerging treatments, new things that you can do, explore with your patients. With Tia, we talked about not just surviving, but thriving, right? And this notion that you found you were surviving, you were doing well.
I was doing okay, but then I was thriving afterward. And it just cleared out some things that I didn't even, like my conscious thought, like, I've already dealt with that. And it was like, no, you haven't. Like, let's do this. And so it was really powerful for me. And I've seen it make a huge difference for friends and family. And so I was sold, and
here you are.
And here I am. Yeah. So it's fun to have so much experience, but also be excited about something new that is so effective.
Yeah.
It's really, really exciting.
It's honestly, so this is like a second episode to a 2-part that we've been doing here at the Feels Club. Last time we were able to talk about the science behind the drug ketamine. Today, what I want to do is really start unpacking the therapeutical side of it all, right? You're a therapist. You see patients who are seeking ketamine as a treatment option. So I want to start there. Who qualifies for ketamine therapy? Like, who is ketamine therapy for?
Yeah, ketamine therapy works really well for a lot of mental health diagnoses. So depression, especially treatment-resistant depression, suicidal ideation, obsessive compulsive disorder, and other anxiety disorders. It also can help with chronic pain. So there's just a broad range of kind of mental health problems that ketamine can address.
That's really cool. I I remember the last episode, we did talk about, like the wide range of people that this drug can help. I'm sure a lot of people ask you as a therapist, what's going to happen to me if I take ketamine? What's the simplest overview that you give people when they ask you about ketamine therapy or ketamine-assisted therapy?
Yeah. So I kind of tell them it's nothing like regular psychotherapy because you're taking a medicine that alters your state. And so what it feels like for most people is just dissociation. So you kind of go to a place where you're separate from like your feelings and your body. And so you're kind of in this different state that most people have not experienced before. So it's really hard to describe because there's such a broad range of experiences that people can have. But I just say like you feel really different when you're taking ketamine. And it helps to have a therapist there because of the wide range of experiences. So some people who've had trauma, their trauma surfaces during that. Some people have just a blissful experience. Some people have a bizarre experience. And so you can see different things, you can feel different things in your body. And a lot of times people feel kind of removed and like can see themselves from a different perspective, which can be really, really therapeutic.
That's really cool. And I mean, and also kind of scary. I'm sure a lot of people have anxiety or fear around it.
Especially on the first session.
Right. Because you really are walking into like
the unknown.
And there's so many things that could happen to you, right? I think you described them perfectly. Like I could have an existential, or I could meet God, or meet some sort of like higher being, or meet yourself.
Or just have a weird experience and see different shapes and colors. And I've had ketamine sessions myself. And some of them were just kind of like bizarre dreams. And others were very poignant experiences with my other versions of myself, younger versions. So there's just such a broad experience. It's hard to describe, but what's so great, that's part of what's so great about it, and what's really fun being a ketamine-assisted psychotherapist is that you get to experience that with your clients and hear about it kind of as they're coming out of their ketamine experience and hear what all these, this variety. There's a lot more variety than just in regular psychotherapy. Because people have access to their subconscious instead of just their conscious, right? Which is what regular psychotherapy does.
And I feel, that's one of the great effects of this drug, right? Is because I was talking to Tia about what's literally happening to the brain. And a lot of times I feel, because, you described depression, anxiety, people who are other treatment resistant, a lot of these usually people go through other treatment options before landing here. And I feel like what's happening is there's a block, right? And so this disassociation, this seeing yourself or seeing other beings, or, these varied experiences that people can have, it's almost like the brain is allowing you to remove that block, remove that wall, and just kind of experience what you have to experience, right? For your mental wellness, for your mental health journey.
Some clients are like, it didn't work because they didn't have some big, profound experience. And I'm like, it's still working. Your brain is creating new neural pathways. And so it's really important to respect that over the next couple of days after a ketamine session, to just kind of, protect your brain so it can rewire positive aspects.
I want us to go there. I want to talk like a little pre, during, post.
Okay. Let's do it.
But I'm curious, speaking of like first timers, right? People who are anxious, they're coming to you and they're like, I think I want to do it. They get approved. They go through the whole process. They're fearful. What do you tell someone who's fearful?
Well, first I normalize it and I just say, of course you're fearful. It's a new experience. Humans are scared of new things generally, right? So I validate and just say, and I use my own experience. When I did it the first time, I was like, I don't know what, my anxiety was higher. And then I really encourage them to be open to whatever comes up and to trust that your body and your mind are going to have the experience that that you need to have, and kind of just be open and curious about the experience.
Yeah.
And to not have specific expectations, just go like, let's see what happens.
Let's see what happens. So let's talk a little bit like the beginning to end.
Yeah.
So someone goes to Anew, they check in, right? They have a wonderful provider like Tia, who we met on the last episode. They get their vitals, they check them in. Do you meet them there as their therapist? Are you at
I will
the door?
have met them before.
Okay.
But I do come in pretty soon after, and I will have already established a relationship with the client. Either they may be a pre-existing therapy client of mine,
Sure.
or if not, we will have had a phone or a Zoom check-in before, so I can get to know them. They can feel more comfortable with me, because just to have a stranger walk in at a vulnerable time would be
Sure.
really overwhelming.
Yeah.
And so usually, it's like, oh, hey, good to see you again. And so there's already a rapport established.
Yeah. I know there's a lot of like prep, because you're going in for medical treatment, right? You're getting a drug administered to you, fasting, making sure that like you've rested well, drink water. From a therapeutic side, what do you tell your patients to come prepared to, like the day before or the morning of? Like what kind of mindset should they be in? Like what do you tell them to prepare them as they are walking through that door and receiving treatment?
Yeah, so I will tell them that day to take good care of themselves. Don't be overly stressed. Don't pack in a bunch of things at work. Try to like take it easy that day, and to really honor the experience, because it can be a life-changing experience. I love it when clients will journal and kind of be pondering and thinking, what do I want to get out of this experience? So they come up with intentions before they receive the medicine. So I'll have them think about that, journal, and just really kind of try to open up their heart and mind to whatever the experience has to teach them.
That's so fascinating. I mean, and it's somewhat intentional. I've done a lot of talk therapy in my life, and you can't tell the difference, right? Like I've done therapy where I'm like in work meetings back to back to back. I've scheduled my Zoom like therapist session, squeeze it into in between meetings. And like you walk in and you're like, okay, yeah, I'm stressed or whatever. You talk about whatever you have to talk about.
Yeah.
And you sometimes don't get a lot out of it because you are squeezing it into, or you're not intentional, as I think what has been my case.
Yeah.
But when I am intentional, when I can journal, whether it's the night before or think about like, what do I want to talk about and why do I want to talk about it? That same level of introspection is what you're hoping your patients are getting through before going in for the treatment.
So that's the mindset. So kind of helping them with their mindset of like being open to new experiences, being curious about it, trusting me. And my job is to create this container where the client can have a powerful experience and feel grounded if they, if something scary comes up, or they feel like they're safe and they're not alone in the experience.
So they get the drug administered. You're in the room with them at that point?
Yeah. I'm in the room before they get the medicine. We'll have come up with 3 intentions of what they kind of want to hope to focus on, but sometimes people get really caught up on the intentions, but it's just kind of a general, like, this is what I'm seeking.
Yeah.
Right. And so the experience may or may not match with that, but it kind of is important to have some goals in mind.
Yeah.
So then they have the medicine, and then that's when the process really begins. Yeah.
Do you find that a lot of patients that go through it with you in the room, are they talking to you? I remember I asked Tia this question, like, are you talking? Are you like so disassociated that you're just laying there like pseudo asleep? Like what do you see from like sitting there? If I was here,
so
like
if someone were watching, you'd be like, nothing's happening in that room. A lot of times it's quiet. And people aren't able to talk until they're coming out of the medicine.
Yeah.
And then they're able to kind of express what's happening. There are some that talk during it.
Oh, okay.
Yeah.
It's like, so it does happen.
It does happen, but that's, in my experience, that's the exception, that people are just chatting the whole time or actually like talking about, narrating what's happening for them.
Sure.
Usually it's when they're coming out of it that they're like, wow, I saw this, or I felt this, or this came up for me.
And then what's your role there? Like, do you help? I mean, this is going to sound kind of funny. Are you like dream interpreting? I know that's not necessarily that, but like, Are you talking
What
to
am I
them?
doing?
Yeah, like,
Yeah.
are you helping them ground them? Like,
I'm
what?
helping ground if they need that. I'm reminding them of their intentions. I'm watching their face and their breathing closely. Like if they start tearing
tear
up,
up.
I will have asked for consent for touch.
Sure.
So I'll touch their foot or their hand or arm and just say like, you're here, you're not alone, you're safe. Remind them that they're doing ketamine, that whatever they're experiencing is okay, and remind them that, that I'm there to support them.
That's really cool.
Yeah.
And it is, I'm imagining, very vulnerable to be in that situation.
Yeah.
That's really cool.
Yeah, it's an honor. It really is. And every session is so different that you just don't know what is going to come up for people.
Yeah.
And so as they're coming out of the medicine is often when they'll talk. And some people are like, I don't remember anything. And some people are like, oh my gosh, I saw this and this, and I, this person visited me, and so it totally depends.
Yeah.
Or I saw weird shapes and cats, and
Yeah.
I don't know what to make of that.
Yeah. You're like, there was a blue rectangle just kind of coming at me.
Yeah. So there's not a lot of interpretation that goes on there. That happens more in integration sessions.
Okay.
So we would really recommend that within a few days after the ketamine session that clients do an integration session. And that's where they'll bring their journal and talk with their therapist. And that might be me, it might be another therapist that they've been seeing ongoing.
Yeah.
But then talking about, okay, how does this tie in to what we've already been working on? What meaning do you make of this? So it's not really my job to interpret anything for a client, but just to help them make sense of it.
Sure.
And integrate and make changes in their real life.
Right.
So it's not just this experience they had, but that they can really, that's why it's called integration, right? Bring it into and make changes.
Into what they're doing in the talk therapy, right? Like
Exactly.
and making meaning out of it, but the meaning that they want to make out of it, not the meaning that you want to attach to it. Right. You're not interpreting.
Yeah. And often I will say, like, okay, what part of this is an aspect of you? Like, I kind of use it like everything that comes up is a part of you. And so what is that object? What might that represent?
Yeah.
Or what might this person represent in terms of an aspect of you?
Yeah.
So I'll use that in integration quite a bit.
That's really cool. Do you see a difference between patients who are going in with like high levels of anxiety or depression, and like the differences between anxiety, depression, OCD, PTSD? Like, are they seeing or experiencing different things depending on what mental illness they're going in for?
I haven't noticed that, and there's probably research on that,
Sure.
but I'm not aware of it.
Yeah.
That's a really cool thing. Maybe I'll start like tracking that a little bit more closely.
Yeah, I'm just curious, like, if you are going through whatever you're going through, if there's like a difference between, I'm glad that the medication is helping regardless of the situation.
Right.
But
one thing I didn't mention earlier is trauma. People come in and are able to process trauma fairly quickly compared to just talk therapy.
Can I go a little off script?
Heck yeah. I love off script.
Because what you describe, I've heard a lot of EMDR, and I don't know if you're familiar with EMDR.
I am. I'm not trained in it
Sure.
though, so I'm not an expert in that.
Okay, but there is like a disassociation or like a thought process, like, I don't know, interpreting that happens in EMDR that I've heard from folks, like, and comparing that to ketamine therapy. And again, we can cut this off if we need to, but like, it's just curious if like, is it similar? Is it different?
I don't know. Since I'm not an EMDR trained
Sure.
therapist, there are other people who would have
Probably would
better
speak to it
answers.
more.
Yeah.
Let's keep that off the. Yeah.
Okay.
That's
Yeah.
great. My brain was like, wow, that's so cool. Okay.
There's so many ways to get to the heart of what needs to be healed, right? And ketamine is just one way to do that. And what is so fun as a ketamine-assisted psychotherapist is just to see how quickly people process and feel better. I mean, sometimes in one session, people are like, I woke up and I didn't feel like a 10-pound weight on my shoulders, or 100 pounds or 1,000,000 pounds. It's like, in a session. And so it's not always like that, but
Sure.
sometimes it's so quick compared to talk therapy.
Yeah.
And I've been a psychotherapist for over 30 years.
Right.
And so that's what's really exciting to me is just how rapidly people can make progress.
The speed at which people are able to, and what seems like obstacles that felt insurmountable.
Yeah.
Right. And I think that's what's so cool about this emerging treatment. And what I learned from Tia is like, you know, the treatment resistant folks that have tried and tried and tried again. We obviously can't promise this works for everyone, right? Everyone's experience is unique, but if you try it and it is what works, like to see, it's almost a miracle, and to see how that transition happens.
Yeah. One thing that's so great about Anew is the focus on the integration session. There are some clinics who just give the medicine and don't have an option of having a therapist and don't do integration sessions. And so it's just get the medicine and then you're done. Yeah. And that's why I love working with Anew, because they understand the therapy aspect and how crucial that is to actually creating long-term change.
Yeah. What you sharing that, it backs what Tia and I were talking about in the last episode around, you know, clinically they're seeing that happening. They're seeing the change, this suicidal ideation, the, you know, high levels of depression and anxiety, the PTSD, the trauma that people walk in through. Clinically, they're seeing that is curbed so quickly, even with just one session.
It's incredible when that happens.
And to hear it from you from a therapeutical side, right? Working with patients that you might have worked with for a long time, see that instant change after just one session just speaks to the power that ketamine-assisted therapy has on people's mental wellness, mental health journey. Yeah. And it's incredible to see how helpful that can be.
Yeah. And I think it's important to bring up, it doesn't work for everyone that way. And so, you know, there's no guarantees. Like I said, it's a tool. But more often than not, there is significant progress. Yeah. But there are those cases that they don't notice a lot of difference. And you know, we try to figure out, okay, what's blocking that? What's getting in the way?
I want to hear more about your experiences with your patients. Just giving a general overview, what are some of the emotional experiences that people go through when they go through treatment? We've touched on a few of them already.
Yeah.
You've shared like meeting versions of yourself, deity, or past people in your life. Like, what are some of those other emotional experiences that people go through?
So for patients who've had trauma, sometimes they will relive the trauma. And it's really hard to see.
Yeah.
And what's great is that they have a different perspective on it often. So they're feeling it, but they're also a little bit detached from it.
Yeah.
And they're experiencing it with a therapist in the room. Right? Where when the trauma first happened, there's not a therapist in the room, right? They're by themselves. And so that can be really therapeutic for clients. There's also a common experience of people feeling connected to like all humans and nature, just this interconnected feeling.
Oh, that's so cool.
Yeah, I know. There's you know, kind of more scary, fearful experiences, but there's also beautiful, that interconnection with everyone and all living things. Yeah. There is experiencing yourself differently, like having a different perspective on yourself.
Almost like third camera, like seeing like a TV show of yourself.
And experiencing different emotions that you're not used to. Like if you have a lot of anxiety, maybe feeling free, feeling relief, or like having a different kind of experience than you have when you're not, you know, under the ketamine influence. It's really a broad range. And again, sometimes it's just like bizarre dreams. Yeah. Just weird shapes and colors and things happening.
You mentioned, I mean, and I love our facilities at Anew, and I think they foster. I talked to Tia a lot about this. Like the setting, the place that you go to matters a lot.
Yes.
Not just from like, do they have the support team, the right medical team, the right therapist team? Anew, the facilities are incredible. Each room feels extremely private, is extremely private.
Right.
From the colors of the rooms to the furniture you sit on, the music that can play in the background for you, all of that, I'm assuming probably also adds to the experience, right? Like when you said feeling connected to nature, I'm someone who just feels like that. That just feels really connected to human beings and humankind, and but to be able to experience that in a space of calm, serenity, I mean, honestly, you just have to like look at the pictures or walk through the building and you feel like you want to connect to nature or to people, or I don't know, the space has something to do with it as well.
Definitely. So there's the set, which is the mindset, and then the setting, which is the physical environment, the people, the colors, the furniture, the art. And Anew does a really great job of being very cohesive and having this calming feeling when you walk in. It's very peaceful.
And then you have therapists like you who are there, you know, working with people to help them on that journey, which is...
It's a beautiful place to be and to help people heal.
We've been talking a lot about almost not theoretical, but just general experiences around this. I know you see a lot of patients. My one point of reference, I have a really close friend who went through multiple sessions of ketamine, and each session, honestly, in his recounting to me, it wasn't connection to space or meeting a god. It was actually quite terrifying and scary, like feeling like the death of self, and, you know, not to go into any details, but it wasn't a pleasant experience. Can you can you give us examples of experiences that you've seen, and it's maybe some of the ugly, right? And it is nice to think that everyone's going to have this beautiful experience around disassociation, but it can also be frightening.
Yeah. Sometimes clients will come in thinking that they know like the source of, okay, I'm stuck because of this experience. And then they do their ketamine treatment and their body and their mind tell them like, no, it's something else. It's this thing. And they uncover something or they experience something that was not what they thought. So it can be really intense. I mean, people are sobbing, thrashing around, like, you know, talking, saying things, crying. I mean, just lots of tissues.
Sure.
So I mean, there's such a range, right? There's such a range. In one of my personal sessions, I didn't see anything. I just sobbed and had this sentence going through my mind about someone that I couldn't save. And it was just like the whole time, like an hour, I'm like, really? But I was like, oh, okay. I didn't realize I felt like I needed to rescue this person. And now it's like I can kind of let that go. So it was like so sad and so tragic.
Sure. And
then another session I met different versions of myself and just felt so much love from each of them, and I could give them love. And so it's beautiful. So it's like light and dark magnified in ketamine sessions.
Yeah. And that's, I mean, to kind of like put a nice bow to my friend's experience, ultimately, like ketamine helped him overcome so much that he was facing, his anxiety and just the things that he was seeking care for. The process wasn't ideal, wasn't pretty. Yeah. But I mean, that can also be said of therapy in general, right? Like unpacking in talk therapy, your trauma, your past experiences, your depression, your inner demons, like all of it, it's not pretty sometimes. And so it almost feels like the ketamine unpacks that, maybe.
It unlocks, and I really think it just brings up what you need to process. Yeah.
Whether you think you know what you need to process, or
because it's there's subconscious things, right? Like in my crying session, like I didn't realize that this was something I was holding on to, because it's like I've done tons of sessions, years of therapy of my own, and it's like I thought I worked through this, you know, and so it just is everything magnified, and I think this is kind of a good case for doing a series instead of just a one-off.
Sure.
Because you can have a bigger variety of experiences.
And that's what most treatment plans are, multiple sessions, right? Correct me if I'm wrong. But like it's not just like a one and done. Like people come repeatedly to unpack and go through it. Although that first session may be like a turning point for most people, but that there is still that repeatedness. Yeah. Talk to me about losing control. I mean, you shared a little bit that it could be a lot of crying. It could be thrashing. It could... there could be a physical component to it. Yeah, shaking. Like, what do you, as a therapist in the room, How do you help people who lose control? Lose control, right? I'm going to say
Yeah.
lose control, but it
Yeah.
could be
So
something else.
a big thing that I focus on is breathing, because people stop breathing normally and they'll hold their breath. The anxiety comes up. And so a lot of times I'll just start there with like, okay, take a deep breath in, doing box breathing.
Sure.
So I'll start there. Sometimes one of the medical providers will bring in something cold, because a change in temperature can kind of
Jolt you to reality a little bit.
Not reality, but like it jolts your nervous system and kind of can help you shift.
There's like a physiological component to it.
I mentioned this earlier, but the use of touch, like holding their leg or their arm or hand and reassuring. I do that a lot when people are upset. Yeah. And then also a lot of validation. Like, this is really hard. Yeah, you're feeling a lot, and you're doing good work. Kind of like just validating what's happening.
Yeah.
And that it's work. Like, this is what's supposed to happen,
yeah,
right? This is what you need.
Yeah. Validate the experience that they. Yeah. And that's, I'm sure, harder when it is more of that like loss of control experience versus like a quieter, more meditative experience. But in either situation, that validation from your therapist in the room with you, I think that's what's so fascinating to me. Like, as someone who hasn't experienced this, and I'm not a professional in that space, is to be able to have someone there with you. Like, that's.
Yeah. In my personal ketamine, I did 6. I had a therapist in there for 2 sessions, and those were the most impactful sessions. Like, it made a difference to have someone in there as a support to build this safe container. Those were more meaningful. And so that was really, that really inspired me to want to become a ketamine-assisted therapist. Yeah.
To be that person for others.
Yeah.
I know some people opt in to like a loved one or someone they trust, a family member. Have you done sessions with like a third person there? Or is
didn't.
It...
I just had myself or a therapist.
Okay.
Yeah.
That's really cool.
But I know a lot of people do. And I've been in sessions where someone has a loved one and me in the room. In fact, that recently happened where there were 2 support people there. And it was a really good thing.
That is really, yeah. And again, and I think what I love about what you're describing is that it's customizable to your experience, right? Like, what is going to help you feel less anxious, less fearful as you're walking into this, particularly your first time, but even on your second, third, fourth session, to be able to have the support system that you need around you as you're going through this very big moment in your health journey. Yeah,
it's a big experience.
This has been so enlightening to learn about it. I'm sure as people are listening to our conversation, there are people who are thinking, is this the right next step for me? Is this the thing that's going to help me? How do you know, or what would you tell someone who's come to you as a patient or a loved one and like, am I ready to seek ketamine therapy? What would you say to them? How would they know?
I really think people's intuition is often right on track. So I would probably say, if you're thinking about it, it wouldn't hurt to get an evaluation.
Yeah.
Right. I usually would refer someone who's already done some therapy, tried some medication, like they have some tools to kind of regulate. They also have to be open to it. Like, if they're just like, oh, it's not going to help me,
Yeah.
I think they have to buy into it a little bit in terms of like, I have hope that this can help me, because you can fight it and not have a helpful experience. I think people who have not addressed their trauma at all through regular talk therapy probably should wait and process some of it, because if there's a lot consciously that you can process, do that.
Sure.
Do that with your therapist.
What I'm hearing is like, this shouldn't be the first time this isn't the first stop, right? Like, this isn't where you start in your healing journey. You should have done some form of talk therapy, medication.
And have some skills and some self-awareness. I think that is really important.
Yeah. Because we've talked at length about the good, the bad, and doing the work leading up to it. But I like what you're saying around following your intuition. If there is that little bug in your ear that's saying, hey, I'm going through this, I've tried multiple things, it's been years or months or however long it's been, to just like lean into it. And what's wonderful is that folks can visit our site. They can text our number at anewtherapyutah.com and get in contact with one of our providers and take that like curiosity out of your mind, right?
Exactly.
Like just meet with someone, talk about your history if you're medically approved for it.
People generally wait too long, just like for psychotherapy, people wait too long generally. So if you're thinking maybe this could help me, get an evaluation. They'll say, no, this isn't appropriate for you, you know, or they'll say, yeah, I think this could be really helpful. So it doesn't hurt to look into it. And people generally wait too long and suffer needlessly when there's something you could do about it.
Yeah. I mean, I hope that our conversation has been a glimmer of hope for folks out there that listen in, whether for them or for someone they love, to start thinking about this as a potential treatment in their mental health journey. I thank you for sharing your experience. I think it's helpful to have someone who is trained to do this, but also that's, you know, it's not a requirement, but that has gone through it and like can share what their experience has been like. So I appreciate you doing that for us today.
Thanks, Mo.
Yeah. This has been so wonderful.
It's been fun.
Thank you so much for joining us. This conversation was so enlightening for me personally, and I hope it was for our listeners. If you enjoyed this podcast, like, subscribe, follow us on our social media platforms, and we'll see you on the next one.